Hi, welcome to You and Your Health. I'm your host, David Bertone. Today's show, we're going to talk about some common injuries that occur to the shoulder. Lots of people have questions about different injuries that occur to the shoulder, and there's some myths and misinformation out there about various pathologies that can occur in the shoulder. So we brought in an expert to talk about shoulder injuries. Our guest today is Dr. Brian Torpey. Dr. Torpey is a board-certified orthopedic surgeon and a partner in Professional Orthopaedic Associates with offices in Tinton Falls, Toms River, and Freehold. Dr. Torpey is also the team physician for Monmouth University and Georgian Court University. Dr. Torpey, welcome to the show.
Thanks, Dave. Thanks for having me on the show.
Great. Tell us a little bit about your background.
Well, as you mentioned, I'm an orthopedic surgeon. I grew up in the Washington, D.C. area, actually.
Okay.
And then I went to college down in North Carolina at Wake Forest, and then ultimately medical school back in Washington at Georgetown University. And then I finished up my orthopedic training at Johns Hopkins with a fellowship in sports medicine.
Great. Excellent. And you're practicing Professional Orthopedic Associates. How long have you been there?
I've been there for 16 years now.
Okay.
And I came up after I finished my training at Johns Hopkins. I wound up marrying a Jersey girl.
Okay.
Brought me back to New Jersey, or brought me to New Jersey, and I started with professional orthopedics then, and I've been there ever since. Very happy.
Excellent. And I know, during the course of your career, you've seen obviously many different injuries, and the shoulder just happens to be one of the areas that you have expertise in. So we wanted to talk a little bit about some of the common ailments of the shoulder. And I think before we do that, we need to review for people some anatomy about the shoulder.
Yes.
So if you can talk to us about what the shoulder is all about and what some of the parts are,
certainly,
that would be great. Maybe grab our little model here.
Okay. Let me get this off the stand.
There you go.
The shoulder people think of the shoulder as one joint, but in actuality, it's really four joints. And if we take a look at this model of the shoulder, we have the collarbone up top, and we have the arm hanging down. We have the shoulder blade, which I'm turning here, and then we have the socket where the ball in from the humerus or the arm bone touches the shoulder blade. Now, the four joints are where the collarbone touches the breastbone, where the collarbone touches the top of the shoulder, where the ball and the socket touch, which is what we usually think of as the shoulder joint, and then where the shoulder blade glides on the ribs in the back of the shoulder. So those are the bones that make up the shoulder. And then, as with all joints, there are muscles that go around the joint to make the joint work. They're not shown on this model, but they are the rotator cuff and then what we call the shoulder stabilizers.
Great. Now, I mean, that's one of the common things. When people think about the shoulder, they just think about the main joint, which is the ball and the shelf area there, what
Correct.
we call the glenohumeral joint. But there are four joints, and that creates a lot of motion, right? So the shoulder has a large degree of mobility.
Yes, the shoulder is very, very complex in its motion. It's a ball and socket joint, so it allows the arm to move in many different directions. The shoulder itself is basically designed to have so much motion so that it can allow you to move your hand and get your hand to your mouth, so that it can assist you in feeding. That's where the design came from.
Now, these again, people hear about the rotator cuff in the news all the time.
Right.
What is the main function of this group of muscles? We know that there is a group of those, and there's four different muscles that make this cuff.
Correct.
Now, some people misuse the terms and say rotator cuff and things like that, but what are the importance of these muscles, and why are they so injured?
Well, the rotator cuff muscles are located around the shoulder. There's one in the front, and then there's one basically up top in this little hollow in the back of the shoulder blade, and then there's two that are on the back of the shoulder blade. And they come from where they're located, and they head towards the front of the ball, and they wrap around, and they form a cuff as they hook onto the ball, similar like the cuff of your shirt. And what happens is those muscles, when you need to lift your arm up, when you need to lift it and start to raise it away from your body, then those muscles are what initiate that motion. They help keep the ball snug in the socket, and they allow you to turn your arm in and out. Very important muscles.
So their function not only to help you raise the arm, but also to keep the ball in that socket, right?
That's correct.
One of the confusing things when my patients are, they don't understand the instability factors of the shoulder and how without these dynamic supporters, they can develop some pretty significant problems. So that's why we tend to work on those a lot.
That's a very important point. One of the things that that we know helps the shoulder out tremendously is to have the muscles toned and have the muscles strengthened so that they will help support keeping that ball in the socket. That's why physical therapy and exercise is important in keeping the shoulder in good shape.
Great.